Hello, my name is Christine McCormick, neonatal speech and language therapist in the Belfast Trust, and I'm going to talk to you today about positioning for bottle feeding our preterm and fragile infants. So, one of the positions that a number of people seem to like to use with our babies is what's known as the occipital position, where the baby is held at the back of the neck in front of the feeder. And when I ask people why they do this, they often can't tell me. They've maybe been taught by someone, but this is not a good position for our fragile preterm infants who have low muscle tone, because holding them at the back of the neck means that they collapse in on themselves, and if they have any weaknesses in the airway, these will become more pronounced. Positioning for bottle feeding is very important because it supports the baby and reduces the risk of aspiration. In this position, yes, you can see the baby, but the baby's body is not supported. So this is not a good position. With a bigger baby, we would aim to put them in a supported cradle position. I sit back in the seat, as you would feed a term baby, using your body to support the baby. With a number of our smaller babies, however, with plastic aprons, in this position they'll often slip under your arm, so it's not ideal. And this is where the raised side-lying position comes in. Now for this, you may need a pillow, and you want to get the baby in a slightly seated position initially, and then on their side, with bent at the hip and their bottom against the feeder's tummy. You then run your arm up along the length of the baby's back and support them at the neck and the head. And then you get your bottle. And in this position, you can feel the baby's breathing. You can see the baby for any colour change. So this position was developed by one of the neonatal teams in London, who reviewed 3 different feeding positions and found that babies fed in this raised side-lying position, where the pillow lifts the baby's head, or alternatively, if you don't have a pillow, pop that out of the way, you can cross one leg over the other, or cross at the knee, and you just want to keep the baby's head higher than their hips. And in this position, the baby has better control over their breathing, and they can lose any fluid from the mouth if the flow is too quick for them, and it allows the feeder to see the baby and feel the baby's breathing.